So I've spoken to the AIPT simulation assessment team today, and my name's Ben Rocavert, and I'm submitting my second assignment to correct a few mistakes from last time. I've actually changed the subject to a guy called Terry, and he's volunteered to help out with this exercise. This is the fitness component of our session, and he's going to be doing the wall push-ups. So I'll just introduce you to Terry. Terry, come on over here. Thank you for helping me out. No problem. Now, first of all, I'm going to demonstrate exactly how to do this, okay? So, what we're going to do is simply hands shoulder width apart, feet roughly shoulder width apart, and then I want you to just go as far as you can towards the wall and then back, okay? Just for as many as you can, and I'm going to show you that again, okay? If there's any complications or any questions, just ask me, right? Trying to lean forward, so you should feel it in your pectoral muscles coming back, and you're going to be slightly using your triceps as well, okay? When you do this, I encourage you to squeeze your core to make it a bit easier on your body, all right? Okay. So it doesn't matter how few or how many you can get out, and then I'm just going to record this, and then we're going to come back and we're going to record this again in about 4 or 6 weeks' time. I understand he's also got some injuries. He's got a problem with his right wrist, so his range of motion might not be very, very good. Anyway, Terry, just give it your best and see what you got. That's it. Good job. Like I said, just keep going until... Good. Good, good, good. So you can see his range of motion isn't quite there, but he's doing a pretty good job considering the condition he has with his right wrist. So that joint is really under a little bit of strain. Yep. So can you feel it in your triceps along with your pectorals? Mm-hmm. Yep. Good. Number 6. See if we can get to 10. 7, 8, 2 more, 9, nearly there, and 10. Great. So, Terry, you've done 10. So how we can improve on that is obviously we're going to keep persisting with that every couple of days, as long as we continue to see each other, and hopefully we can get that mark up right up to a good substantial number, and try and quadruple it over a period of time. But like I said, we're going to reassess in about 4 or 6 weeks. Okay. Hi, this is Ben Rocavert, and I'm just further explaining the muscles and the joints that you'll be using when you're doing the push-up test, and for any push-up for any client. That's going to involve your wrist joints. It's going to involve your elbow joints, and it's going to involve your shoulder joints. And the main muscles being used are going to be your pectorals, it's going to be your anterior deltoids, and it's going to be your abdominals, and also your obliques, and also your triceps brachii. Okay, so I also need to explain to you about the bent over row and the muscles and joints used in the components of that exercise. So the first thing we're going to be using is our Latissimus Dorsi, okay, which is located in our back here, and then we've got our middle trapezius, which is up in the middle part of our neck here, and you're also going to be using your rhomboids, which are back here, and your biceps brachii, okay? And the main joint that's going to be used in this exercise is obviously your shoulder joint, okay? And that's that for that exercise. Okay, so I'm here to talk to you about the weighted lunge. I actually don't have Wolfgang with me to do this exercise, but I've been given permission to actually just go ahead and demonstrate the main muscles and joints used in this exercise. So, firstly, the main muscles that are going to be used are your gluteus maximus, okay? And then you're going to be using your quadriceps and your hip flexors, okay? They're the 3 main muscle groups when you're going to be going down like this. You can see they're all under a bit of stress here. I can feel that in all 3 of those areas, okay, if you have good posture as well. And the joints that are going to be required and that are going to be put under a little bit of stress are actually your ankle joint when you're on your way down. The opposing foot, your ankle is going to feel quite a bit of stress. Your hip joint is actually going to go through a little bit of stress as well. And obviously the last one is, whichever knee goes forward, this is going to put quite a bit of pressure on the knee, okay? Actually, it puts pressure on both knees. So all those joints are going to be active during this component of the exercise. All right, Wolfgang, so for this part of the segment, we're going to be doing the rowing, innovative cardio, okay? Now, first of all, strap both feet in accordingly, adjusting to your feet. Alright. What I'm going to do is I'm going to put the machine on, and I'm going to make it so that you just got to do about 250 meters. Okay? Alright, so I put a bit of resistance onto this, so as you go, this is basically going to be using your quadriceps and you're going to be using your back muscles. Okay? So I'll show you the front technique. Right? So back into your chest. Okay? This. And you're going to notice a little bit of resistance. Okay? So that's all about the technique. Like I said, your energy sources are your back and mainly your legs. Okay? Okay, now I'm going to give you a go. What I'm going to do is this thing is going to calculate your heart rate. We're going to try and get it up to about 150 or 160. Okay? So I want you to go relatively quickly. Strap yourself in nice and safe. Okay. Alright. Here goes. Okay, so let's go for it. Hopefully it'll take about 1:25. Here we go. That's it. Good technique. Excellent. That nice posture pulling in just below your chest. Good. See your heart rate's already getting up there. It's good. Excellent. Here we go. So you've done 150, almost 150 meters, 150 meters. You've got 100 meters to go. Yeah, that's it. Good. Good, that's it. Really push. Excellent. Yeah. Last few, you're at 220. Now, once you get to 250, I just want you to do a couple of slow ones down, okay? 240. Good, excellent. Now, just do 3 or 4 for me where you slow down. So your heart rate has got to 155. Okay? Not too bad at all. Alright? Beautiful. Not around that angle, right? What we're aiming for. Beautiful. How'd that feel? Good. Good. Alright, beautiful. Alright, okay. We're on. So, now, I put this on, it's going to calculate your heart rate. Alright, I'm going to try and get you to about 80 to 90% of your maximum heart rate. You're going to do this for 60 seconds. Alright? Now, we're going to adjust the seat accordingly. You're a little bit taller than me. Okay? So, I've got a little bit of resistance on there. And when I go, when you come on, I want you to just press start, keep a nice posture, and this is all going to come straight through your quadriceps, okay? And really, I just want you to go as quick as you can for 60 seconds, okay? And then we'll calculate, we'll see what the machine comes up with, and you're going to see how many calories you burn, okay? Cool. All right. Does that feel like a nice, comfortable height? Okay. Beautiful. All right. You feel that little resistance? Okay, here we go. 60 seconds. That's it. Good. Want to get that heart rate nice and high. That's it. Really push. You should be feeling it through your quads. Yep. It's all around the knee joint and the quads. Not much else is under stress there. You just keep going. You've got 30 seconds to go. Beautiful. That's it. There we go. 20 seconds to go. And after you finish, Wolfgang, I want you to tell me how many calories does it say burn? I think it would say between 20 and 30. Here we go. Keep going. Go faster, faster. 10 seconds. Heart rate 150. There we go. Beautiful. Now just a bit of a slow down. Just cool down for a sec. We've done it 1 minute. Perfect. Awesome. Okay, great. Good stuff, okay?
Yep, 80 calories.
Alrighty. 18. Beautiful. Alrighty. Alright, Wolfgang. So, I've devised a circuit training program for us to do, okay, which we're about to commence. So I'm just going to run it by you first, and all the energy systems we're going to be using in between, okay?
Okay.
Alright, so the first one's going to comprise of 3 stations, alright? So the first station, you're going to run up to the first station, you're going to do 5 push-ups. So this is going to be using all of your upper body strength along with your core. So it's going to engage your pectoral muscles and your triceps. Okay? After you've completed the 5 push-ups, I'm going to get you to run to the second station. I'm going to get you to do some squats, which is obviously going to engage your gluteus maximus and your quadriceps. Okay?
Okay.
And then once we're going to run to the third station, we're going to go and do an isometric exercise known as the plank, where you have to get down and you're going to be holding your core for as long as you can. And we're going to run through this 3 times, okay? So my aim is to get your heart rate between 70 and 80% of your maximum heart rate.
Okay.
Sounds good?
Sounds good.
Done. Okay, so I'm here to talk to you about special populations, in this case high blood pressure, otherwise known as hypertension. So some of the causes of hypertension can be the fact that the blood is actually flowing at a higher pressure through the arteries around the body. This can actually cause a heart attack, stroke, or even kidney failure. Some of the common symptoms for this condition is actually obesity, poor diet, or smoking. If I were training a client with this condition, I would try to avoid isometric exercises such as planking, and also holding a ball out in front, because this could cause massive spikes in blood pressure. So basically the stuff that I would encourage, as opposed to avoiding, I would encourage is to have a look at the person's diet firstly. And I obviously try and improve their exercise, because it's been shown that improving their exercise actually, obviously helps with the blood pressure. But before we actually do anything in the regards, I would actually have to recommend that they see a doctor, an allied health professional, and then we can just go from there. Okay, so now I'm here to talk to you about people suffering with lower back pain. This can actually be a condition called lumbar lordosis, which means a curvature of the lower spine. Okay? And some of the most common causes for this is there's a lot of tightness around the glutes, around the gluteals, and around the hamstrings, etc., and the core especially. So you're going to have this little arch here that's very uncomfortable. And this can actually be fixed quite easily. You've got to really focus on stretching out all the muscles in and around the area, and try and encourage the client to do a pelvic tilt, which obviously opposes this lumbar lordosis of having that curvature. Okay, so that's what I would recommend, about 20 a day, and obviously if there's any further complications you should see an allied health professional. Okay, in regards to special populations and someone that has a knee injury, could be caused by a multitude of things, but I think most commonly it's lack of flexibility around the area, so the tendons are actually attaching very tightly to the knee joint itself. And so there's obviously a lot of friction there, and that lack of mobility can really cause to a lot of stress even, and it can all the way go up to your back, your lower back as well. So what I would try and avoid is heavy lifting, heavy compound exercises to do with that, such as squats, where you're carrying a heavy load above and you're trying to go down, so that would obviously irritate any particular part of the knee that is aggravated. And I would try and stick to machines as opposed to free weights, because I believe that would be much safer for the client. And I would do also a lot of stretching around the area to try and really loosen up the muscles in and around the area, and make sure that the person has actually got seen his GP or an allied health professional of some sort prior to commencing training.